Good morning, everybody. Thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. As always, I'm going to take just a moment to click buttons to make sure that all the media who've joined us have permission to record. You will have permission to record, and we are also recording. That video will be available on the Health District's YouTube channel later today. So give me just a moment here. And okay, I think I've given everybody permission, but if you have any issues, please send a message in the chat box to the Joint Information Center and I will get that fixed. Before I turn it over for updates, I do want to share a couple of housekeeping items. We wanted to let you know that the next briefing after today is tentatively scheduled for Tuesday, March 22nd. After that, the plan is to move to a monthly schedule on the first Tuesday of the month. And also wanted to let you know that this will be my last media briefing with all of you. I'd like to take a moment to thank Executive Summers and Dr. Spitters for making themselves available for these briefings for the last 2 years. And I want to thank all of the media who've been working with the county and the health district to ensure that you're providing up-to-date and accurate information to our community. And with my departure, I do want to make sure that you are submitting any media inquiries or questions to Kent Patton at the Executive's office and at the Health District to communications@snohd.org. With that, we are joined this morning by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of our speakers will share their update, and after they're done, we'll take questions in the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. Thank you again for joining us. And with that, I will hand it over to Executive Summers.
Well, thank you, Heather, and good morning, everybody. Thanks for joining us. Good to see you all. I just want to lead off by saying how encouraged I am with the continuing downward trend of COVID in our community. We have far fewer sick people, and the hospitals are once again gaining some breathing room. So that's great news, and that was always a key concern of ours. So while the pandemic isn't over, we are reaching a point where we can drop and relax some of the more obvious health measures like masking that we've been taking and recommending. So I do, though, want to really stress that across the state and the region, there's still thousands of children younger than 5 who cannot be vaccinated. And there are people who have compromised immune systems because of underlying health conditions, age, or just weak immune systems. So there are still many, many vulnerable people in our community that we have to be concerned with. So some of the most vulnerable people, some families will choose to wear masks when they're in public spaces. It's not like masks are making a political statement, but they're trying to keep loved ones healthy and alive. And I myself have a person in my family who's going through treatment and is in a vulnerable state. And so I'm going to continue to wear masks in public. I've been told I look better in a mask anyway. So we, as we get into the recovery part of the pandemic, we shouldn't really forget that we've lost 6 million Americans who've died from the pandemic, and we're continuing to lose people in this country. COVID is going to have multi-generation impacts on our country and community, so we shouldn't underestimate or forget how much pain and mourning that has been generated, and it's going to take some time to fully recover, but we really are turning our focus towards recovery and trying to ensure we remain vigilant. If the disease throws us another curve, we're always on the lookout for other variants, but so far so good. I just want to say the people of Snohomish County have been extraordinarily responsible and really are the reason we can look forward to a recovery with a bit more clarity. I'm so proud of our community, and I know it's been difficult for many in our community, but overall the response has been tremendous, and cooperation has been just wonderful, so thank you. So before I turn it over to Dr. Spitters, I just want to thank Heather Thomas for her leadership and partnership and wisdom as she's helped us pilot through these choppy waters the last couple of years. Heather, I wish you the very best. I know this is your last media availability for the health district before you move on to the city of Snohomish. But again, thank you so much. And I look forward to working with you in Snohomish. So with that, I will turn it over to Dr. Spitters.
All right. Well, thank you, Executive Summers, and good morning, everyone. Before making my remarks, I too just want to say thank you in front of all of you to Heather for the tremendous work she has done on our behalf, not only with communications, but with government relations. Some less visible work, but equally important with addressing the opioid pandemic, bringing grants into the health district, and just being a critical ingredient in our leadership team here. And so, Heather, you'll be greatly missed, but we'll never forget the help you gave us. And our loss is the city of Snohomish's gain. And we look forward to hearing more from you in that role as time goes on. So congratulations and thank you very much. Turning to current events, as Executive Summers mentioned, the news continues to be good with continued steady decreases in COVID-19 cases, hospitalizations, long-term care facility cases and outbreaks, school-associated cases. Basically, choose your metric, and those have all been coming down in parallel. The hospitals had been emptying out a little bit slower, but now they are doing much better. Here are some key figures. Our case rate for the 2-week period ending March 5th came down to 145 per 100,000. For that 2-week period. That represented 765 cases in the last week, which is about over a 90% decrease per week over our peak back at the beginning of January. I mentioned hospitalizations. There are currently 30 people with COVID hospitalized in Snohomish County facilities, with only 2 on ventilators, recalling that at our peak, roughly 8 weeks ago, it was about 230 patients. So again, a marked improvement. This is all welcome news as we head into the recovery phase of the COVID response, and at the same time, maintaining vigilance and anticipating that it would not be unreasonable to expect that at some point in the foreseeable future, be it a few months or next fall, who knows really, that we could face another wave. As the governor announced last week, though, given all these improvements, the lifting of mask requirements has been bumped up from March 21 to 1 click after midnight on the evening of March 11th. So masks will become optional or recommended in most settings throughout the state, with some exceptions. I do want to remind that there are these settings where masks will continue to be required. First, in healthcare settings such as hospital and outpatient and dental offices, pharmacies, long-term care settings, correctional facilities, and also homeless shelters. Businesses and local governments can choose to implement vaccination or face mask requirements for their staff or customers. There's no barrier to them electing to do so. Schools and childcares may choose to have students and teachers wear masks, and they will continue to be recommended in schools and childcare settings at the current time. Federal law still requires face masks in certain settings, such as public transportation, the ground-based stations from which that transportation takes off, and that will remain in effect at least through March 18, when that requirement is scheduled to either be sunsetted or renewed. Just for clarification, the federal government clarified that that public transportation consideration does not apply to school buses or transportation for child cares. Masks will also be continued to be required for isolation and quarantine related to COVID-19. So if someone who was COVID positive is returning to work or school after that initial 5-day isolation period, they're feeling better, asymptomatic, going back to work, they still need to wear a mask at work or when they go to the grocery store or to the friend's house or any indoor public space for days 6, 7, 8, 9, and 10 after the onset of their illness or the positive test result. Furthermore, anyone who is coming out of their quarantine due to exposure to COVID-19, they're asymptomatic, they're doing fine. It's now day 6. They're permitted to leave home and go about their business, but again, must continue to wear a mask in all public indoor settings during days 6 through 10 after their last exposure. Also, remember, as Executive Summers mentioned, that some people may still choose to continue wearing masks, either due to their own desire to avoid risk or to protect others. So anyone who feels more comfortable wearing one should also continue doing so. There's certainly no rule about that. And the longer we can keep, the time and distance between COVID waves intact, the more time we have for recovery. We encourage all people, enterprises, and organizations in Snohomish County to respect the right of people to continue wearing masks, even in settings where they are not required. And like Executive Summers, I have people in my life who are medically vulnerable, and I don't want to bring it home to, so I will continue to be masking in public settings. It's important to note that this announcement does not signal the end of the pandemic. Certainly, it marks a great milestone in improvement. But as I said, COVID continues to be transmitted around the world, and there are, thus far, variants have emerged from settings outside the United States where there have been high levels of transmission that can lead to variants emerging, and then they find their way here. So, this is a sunsetting of the masking requirement, but it's not a bookend on the pandemic itself. We need to remain vigilant and flexible for future times when it may be indicated to resume universal use of masks to protect ourselves, others, and the healthcare system, as well as other essential societal functions. We know that there are likely a number of questions that businesses, communities, and residents will have as we go through this transition. We are working to make updates to our website with information as it becomes available from state and federal partners. I encourage everyone to follow us on social media and to bookmark our website at www.snohd.org/COVID. For employers and employees, we also have additional information on our business webpage, which is again www.snohd.org/COVID business, all one word, no spaces. So with that, I'll turn it back to Executive Summers.
Thank you, Doctor. Let's see, first question, with the indoor mask mandate being lifted, do you have any concerns about that leading to lax behavior followed by a rise in new cases?
Well, I think the most important thing that comes from this is that as we come out of the need or the requirement to wear masks indoors in public, that we all stay tuned and ready for that time when there are signals from nature that it's time to put them back on. And that is the moment where laxity could prove a grave danger to ourselves and the healthcare system and other essential societal functions. In the meantime, we also want to keep our guard up around vulnerable populations, congregate settings, that sort of thing. So, it's not a wholesale elimination of masking, but a targeted relief from it. And we encourage people to see it that way.
Let's see, as the health district winds down its response to the pandemic, can you describe what your relationship will look like with schools with regard to COVID?
Well, we have ongoing I think it's semi-monthly meetings, including one today with the school leadership, and we'll continue to work to provide them with technical assistance in this transition. Ultimately, I think all entities and organizations need to, transition into self-reliance around this, and the frequency and intensity with which we touch one another between the schools and the health district probably will decline as time passes. And then if and when the time comes where there's more transmission in the community, I assume that would turn back up. So it's really, we're still in there with them. We'll continue to meet probably at some frequency throughout the end of the school year, and then take it from there based on circumstances going forward.
What will the county do with its testing and vaccine sites as we move forward? Doctor, do you want to start?
Sure. Well, the funding and the demand for those services, as the funding's expiring at the end of this month, and the demand for those services has dramatically reduced in recent weeks. The daily uptake of vaccines through the vaccine site is now less than 100. Same on the testing. So the marginal addition to what's available through the healthcare system is really minimal. And, the funding is going away. So those will be sunsetting on or about the end of the month.
Don't have anything to add to that, but we'll be relying on private sector and private testing, but also be watching and making sure that we do have capacity for both testing and vaccination in the county. So other questions?
I'll do a last call for questions. All right.
Well, it's actually good news.
We'll take it.
We'll take it.
Well, thank you everybody for joining us. We'll give you 13 minutes back in your day. Thank you for joining us, and stay tuned for future media availabilities. Thank you.
Thank you, Heather.
Thank you.